we found that patients who were treated early, within 3 days of diagnosis, and treated with convalescent plasma that contains high levels of antibodies, have evidence of improved survival, or in other words, decreased mortality. And that's really the main finding of this paper. If people get convalescent plasma with high levels of antibodies and they get it early after diagnosis, their mortality rate appears to be lower. The two signals of efficacy are time from diagnosis to administration of convalescent plasma and the antibody levels in the plasma. And by signals of efficacy, we mean, because this is not a randomized clinical trial, we couldn't compare treatment A versus treatment B and say one was more efficacious than the other, or convalescent plasma versus placebo. So instead, what we had to do is try to extract signals out of our database. The time from diagnosis to treatment had a random element to it, as did the antibody levels in the convalescent plasma that was administered. So that gave us some elements of variability or randomization that permitted us to construct what you might describe as dose response curves, looking at time from diagnosis to treatment and also antibody levels versus outcomes, and then combine the two to demonstrate, or at least provide evidence, that early treatment with convalescent plasma containing high levels of antibodies was probably associated with the very best outcomes. We need to continue to look at our database and continue to try to understand what properties in convalescent plasma are associated with improved outcomes, the volume of convalescent plasma required, or does it make a difference? How much do we need to give? And then we also need to integrate our findings with ongoing clinical trials, and those clinical trials include trials done in hospitalized patients and also trials done in people in the emergency department who aren't in the hospital or not quite sick enough to be in the hospital, and then prophylaxis trials to see if people who've been exposed to COVID-19, if disease can be prevented in those individuals if they're given convalescent plasma.